Hello, healthy moms. Good day, good evening. Hope you all are doing well. Let me try to arrange everything. And now arrange my lighting. How are you all doing today? If you're around, please leave a comment so I can acknowledge your presence before we start. Hello, how was your day? We're still on the breast cancer awareness matter. It's still breast cancer awareness month. So we are still on the breast cancer awareness matter. And today we are going to be talking a little bit deeper into breast masses. As you saw on the flyer, if you're here, probably you saw the flyer. Please, if you're here, please leave a comment or a like. So I go on to acknowledge your presence before I start. I should be starting in about 30 seconds. I hope that this session is going to be a short one. I normally never like to be here very long. Don't mind. But sometimes I just start talking to you ladies and I enjoy your company so much and I just can't go away. So that's why most times. Well, if you're around, please leave maybe a like, a comment, something, anything, so I can acknowledge your presence before I start. Okay, just trying to get everything ready. Okay, the quality is not that bad. I'm checking the quality of the video if you ladies are seeing me very well. Okay. Starting in a bit. How's your day been? I see somebody there. How's your day been? Let me know. My day has been okay, though tiring. Has it been raining in your area? Because in mine, yes, it has been. So, today we are going to be talking about breast masses or breast lumps. Normally, when we get to feel anything like a lump in our breast, we automatically get scared, like the big name, the big C. You feel like, okay, cancer is in the corner, or I have breast cancer. And you just start to panic, which is very normal. It's very normal. Even if I'm the one, I'm going to panic. Okay. Now, let's talk. Talking about breast masses, someone wrote a question last week, Lady Claudia, precisely. And I told her I would talk about this topic on another day because it's a whole other topic, and indeed it is. So today I'm here to talk about breast masses, the causes, the different types, and the remedies, right? So if you probably feel a lump, you don't get so scared, and you can actually calm down and think straight and go for what you have to do. So that's the main reason for this video of today. As I said before, please, if you're around, please leave a comment so I can acknowledge your presence before we go on. Okay, so talking about breast masses, what are breast masses? Breast masses are just abnormal lumps in your breast, like how breast cancer can be. Yes, breast cancer is also a mass in your breast, but there are three main types of lumps. They are categorized into three main types. The first type are the benign ones. Benign means they are non-cancerous. The second type are precancerous cells. And the third type are the ones which are called malignant. Those are cancerous cells. So today, we have to understand that our breast contains tissues of different consistencies, fatty tissues, and so much more. So it can make it sometimes difficult for you to even recognize if you have a lump in your breast. And even when you have a lump in your breast, that is not enough for you to just conclude that it's breast cancer. Thank you so much, Jackie. Welcome. Thank you for being here. If you're around, please acknowledge, leave your name or leave a comment so I can acknowledge your presence as we are going on. And please don't forget to share the video, because there could just be someone out there waiting for an information like this. So I was already talking about breast masses before I saw somebody indicate, so I'm just going to go over on it. So a breast mass is just an abnormal lump in your breast. And lumps are very, very common, more common than we think they are. Lumps are very common, and most of them are not cancer. Just 20% of breast lumps are actually cancerous lumps, or lumps that are going to lead to cancer. So now, as I was saying before, our breast contains different types of tissues with different consistencies and different textures. Sometimes fatty tissues, granular tissues, and connective tissues. It just contains a lot of tissues, which might make it hard for you to determine if you have breast cancer. I also said that every lump in your breast is an emergency, and if you have a lump, it is very important that you go to see your doctor immediately so they can determine what kind of lump that is and know the kind of treatment which they can give you for that particular kind of lump. There are some lumps that will be left there and washed over a period of time, but there are some which will have to be taken care of. Okay, now, as I said before, I'm just trying to go through everything I said before. There are three main types of breast lumps. The first ones are benign breast lumps, and the most common are cysts and fibroadenoma, fibroadenoma. Yeah, those are the two common types, but there are so many other types which I'm going to talk about today. And they are precancerous cells. These are, lumps, which are lumps which might lead to cancer, but there are times which they don't necessarily lead to cancer. And then there are malignant lumps. These are the ones which are cancerous lumps. Now, let's go on and talk about some types of benign breast lumps. I'm going to try to make this I'm going to summarize it as much as possible. Our lives are not to teach you everything. Our lives are just to give you an insight on what you need to know. And if there is something you hear that you're doubting, you can either ask a question, or in your own free time, you go on to read about the things we've talked about. So the first type of benign breast lump is an abscess. If you've had an abscess before somewhere else, you realize that no matter where an abscess is, it feels like a lump and it is hard. So you can have an abscess which has not yet produced its head, and you feel that it's a breast lump. But normally, abscess are pockets of pores. It's like some round area of your body which is filled in with pores, and that's what makes it hard. Now, the next benign breast lump, these are non-cancerous breast lumps, I'll specify, are cysts. So cysts are normally fuel-filled sacs. It is, for example, like something as round like an orange, and then it has water filled inside. That is normally how cysts are. And they can develop in the breast as well. They are usually common in women between the ages of 35 to 50 years old, and usually enlarge during or before menstruation. Why does it enlarge during or before menstruation? This is because during menstruation, your hormones are in play, so they react to it and make it to either enlarge and then start feeling very sore due to the fact that during menstruation, normally you get sore breast and tender breast and all. So another type of non-cancerous lump is fibroadenoma. Why is this name difficult for me to pronounce? Anyways, let me go there again. Fibrad. See, I've listened to this particular word. I've pronounced it about 5 times for coming to the live, like listen to it being pronounced, but it's okay, we're going to get there. It's actually spelled Fibroadenoma. Fibroadenoma. Yeah, that's the right pronunciation. I got it right. Now, this is a particular type of non-cancerous lump, which is solid. It's soft and firm. It is usually painless. It is rubbery. Like if you press it, it can go inside. Yes, and it moves freely. This is a description of this particular kind of lump. I'm trying to give you like very sketchy description so that if you have that kind of lump, you know what you're dealing with and you don't get all scared feeling that you have breast cancer when it's not breast cancer, which you have. So this particular type is common in women between 20 to 30 years old. So if you're 20, between your 20s to your 30s, and you feel a lump in your breast, try to check if it is solid, if it is soft, if it is firm, if it is painless, it's rubbery, or it moves freely. I'm going to give you how cancerous cells feel so that in case you have these non-cancerous cells, these benign lumps, you would know the difference from when you have a lump which is cancerous. So now, as I said before, the fibroadenoma lumps are usually found in ladies between their 20s to 30s, and it usually enlarges also during pregnancy and breastfeeding. This is because of hormones again. So now, the fourth type is sclerosing adenosis. I'm sorry for the complicated names, but I have to make you know so that in case maybe you go to the hospital and hearing some funny names, you know what you're dealing with. Now, this is usually common as a result of the aging process. You know, as you age as a woman, your cells start behaving differently, your hormones start behaving differently. So this particular type is as a result of the aging process and is common with women at the ages of 30 to 40. Also, it is an extra growth of tissue around the milk producing glands, okay? So that's all about sclerosing adenosis. That is the fourth type of non-cancerous breast lumps. Now, the fifth type is fat necrosis. Now, this particular one is round, firm, painless also. It is common with women with very large breasts or women who have gone through some kind of trauma on their breast. Like, there are cases where maybe when you were younger, maybe a ball hit your breast, maybe your brothers were playing with a ball and then it hit your breast when your breasts are just coming out. It can lead to this particular type of breast lump. And yes, those kind of traumas, or somebody has hit you very hard on your breast. That is why it's not good for a woman to be hit on her breast. They might just feel some soft tissue, but it's not good at all for a woman to be hit there. So now, another thing which can cause this particular type of breast lump, which is fat necrosis, is maybe a treatment from a prior cancerous lump. So the radiation can also cause this particular kind of breast lumps. Now, the sixth type is galactocele, which is formed by retention of milk in the milk glands. So the milk blocks the milk ducts, and this makes fluids to fill up in like a sac. It's also like a cyst, but this particular one is caused by retention of milk, right? So it is called galactocele. Now, the seventh type is hematoma. This particular one is blood-filled. So while there are other ones which are caused by milk retention, there is the normal cyst, which is just a fluid-filled sac. This particular hematoma is blood-filled. So it is caused by injury or a formal surgical procedure. So maybe somebody who had a breast surgery to maybe put an implant, or you had some injury in your breast or something like that, it can cause this particular one. So I'm talking here about the causes and then giving you the types immediately. Another one which I'd like to talk about, duct ecstasia. This one is also caused by clogged ducts. So when maybe a breastfeeding mother, I can see your comments. You don't have to cram the names. At least by hearing it today, if you hear it somewhere someday, you have an idea of what they're talking about. That's the most beautiful thing about our live sessions. Like, you hear these names, and the fact that you've heard it, it will be retained in your brain. And anytime you hear it somewhere, you can at least have an idea of what they're talking about instead of just being totally blank. So I was talking about duct ectasia, which is also as a result of clogged ducts. So a breastfeeding mother, maybe not breastfeeding for a while, can have her breast very full and then her ducts are blocked. This one usually leads to swelling. It also leads to discharge, to a grayish discharge actually. And it is usually found under the nipple. So under the nipple, that's where it is usually found. So if you find a lump under your nipple and you feel it, you know that you're breastfeeding and you've not breastfed for a while, and you feel that lump there, you know that is a non-cancerous lump, and there is no need for you to be so scared, but still you need to visit your doctor so they evaluate it better to know what exactly is wrong with you. Now, let me go on to explain what a cancerous breast lump feels like. Before I do this, I'm going to go through again on the names of the non-cancerous lumps. I have mentioned 8 here, but there are so many more. But these are the 8 most common ones which I've mentioned here. I'm going to start with the first one. I'm going to just name them. I assume that if you are just coming in now, you can go on and watch the start of the video to get the explanations about them. But the first non-cancerous lump is an abscess. The second one is a cyst. The third one is fibroadenoma. The fourth one is sclerosing adenosis. The fifth one is fat necrosis. The sixth one is galactocele. The seventh one is hematoma. And the 8th one is duct ecstasia. So you can go on by yourself and search for the other ones, but these are the most common non-cancerous lumps. These are other reasons why you could have lumps. So if you have lumps, it could be from any of these other types of breast lumps and not necessarily breast cancer. But again, if you have a lump and it does not feel like how breast cancer lumps feel from the explanation I'm about to give you now, it doesn't mean that you should stay and not go and see your doctor. For any lump you feel in your breast or any changes in your breast, you are supposed to go see your doctor for them to confirm what is wrong with you. Because with breast cancer, early detection saves life. Now, how does a cancerous cell normally feel? The first one, it is hard to the touch. If you touch it, it's very hard. Now, on the surface of your breast is going to be some kind of pebbly. It's going to look like pebbles, or you have what they call orange skin, right? So the outside of your breast might look like the skin of an orange. That's what they are trying to explain as the pebbly surface. Now, the next thing, which is a way that a cancerous breast lump will feel, is they are commonly located under and on the outer quadrants of the breast. Did I say under? It's located on the upper and outer quadrants of the breast. So usually around here or around here, that's where you feel the cancerous lumps. Now, one thing that you should know is that they are very hard and they don't move. If you try to move them, they don't really move. So they're in a particular place. And also, a cancerous lump will lead to an irregularly shaped breast. Those are some things you should look for if you have a lump before you're going to the hospital, okay? Because there are times which you could just have some, like a cyst, which is water-filled, and it's not actually a cancerous cell. So you need to know these things to be able to, when you're examining yourself, you can know what is wrong with you. At least you can have an idea so that it takes away the ignorance, the fear, and everything. Now, I'm going to talk about the precancerous breast lumps. Now, the first one, I'm just going to name them. If it is something that you're interested in knowing about, you could go on and search about them. The first one is intraductal papillomas. The next one is radial scars. These ones might not even be felt. So it is very important that if you just start feeling some discomfort in your breast, or it is just important that you go for your breast screening maybe once every year or twice, once in 2 years. If you have history of breast cancer in your family, it is very important that you go once every year. But if you don't have any history of breast cancer, you could go once every 2 years. But if you've passed childbearing age, you need to start going once in a year. Now, I was talking about radial scars. The third one I would like to talk about are ductal or lobular hyperplasia. Ductal or lobular hyperplasia. The fourth one is in situ tumors. Now, in situ tumors are of two types. They are ductal carcinoma in situ, that is DCIS, or lobular carcinoma in situ, which is LCIS. These are just tumors. Now, the last one I would like to talk about are Phylos Tumors. These ones are also precancerous lumps. And as I said before, please, every lump in your breast or any change in your breast is an emergency. So if you see any change or you feel any abnormality in your breast, it's an emergency. So try as much as possible to go see your doctor, and they'll be able to help you diagnose what is there. I'm going to go on deeply to explain to you what goes on when you actually go to the hospital for a breast screening. Now, after the precancerous breast cells, if you don't have precancerous breast cells and you don't have the benign breast lumps, I don't know why I keep saying cells, breast lumps, then whatever lump you have might be breast cancer. But I'd like you to know that even if you have breast cancer, it's not the end of the world. There are lots of things that the doctors can do for you, and there are many survivors out there, and you can be one. Just believe in it and follow your treatment as much as you can. Now, I'm going to go on to talk about when to consult your doctor. Now, it is very important for you to consult your doctor when you realize any new breast lump or any thickening in your breast. Also, changes in the size and shape of your breast or the appearance of your breast, you should see your doctor. Now, pain that doesn't go away after maybe your period has come and has gone, and you wait again after the next period, it doesn't still go away, you should go and see your doctor. Now, any spontaneous nipple discharge, you should go and see your doctor, because it is very, very important for these particular symptoms for you to hurry up to your doctor, so that if it is a problem, they can actually detect it and solve it early enough. Now, when you go to the hospital for maybe a breast screening, say, okay, you are doing your breast self-examination. If you've not done it yet, we have a video on breast self-examination. Please go check it out and do your self-examination at home. You can actually do it by yourself. And if you find anything and then you go to the hospital, this is what to expect. Now, first, there will be some clinical examinations where the doctor will by himself feel your breast and try to understand or know where he can feel the lump. There are some lumps that just by the doctor feeling your breast, they can determine what actually is wrong with your breast. But most times they don't depend only on their fingers, because their fingers are not machines actually. So they'll really want to take you through the machines so they can confirm certain things before they can give you diagnosis, or they can write you drugs or determine what kind of treatment you're going to be able to follow. Now, after the clinical examination, there are going to be some questions. They're going to ask you if there's anybody in your family with cancer, how long you've been feeling the symptoms, and what kind of symptoms have you felt. They are just going to ask you a lot of questions, but be calm and just answer the questions. If you're actually going to the hospital to take a screening, maybe for no reason, or you're going or you're going to take a screening because you felt a lump. Now, if after the clinical examination and after all the questions and everything, a lump is found, they are going to do an imaging test. These imaging tests include a diagnostic mammogram, which I talked about, which I threw a little bit of light on in our last live video. And after the diagnostic mammogram, a breast ultrasound to check the lump will be done. And then next, actually a breast ultrasound is to check the size of the lump, where it is found, and what is inside the lump. Okay, now the third thing which they are going to do, if maybe the first two tests do not give clear results, is a breast MRI. A breast MRI in full is a breast magnetic resonance imaging. This is actually to really look at your breast and diagnose whatever is wrong with your breast. So if the first two tests are not clear enough, they will now go on to do a breast MRI. Now, after that is done, if actually it is confirmed that you actually have a lump, they are going to do a breast biopsy. Here, something is sent into your breast, like a needle, to actually remove some tissue from the lump, so that they can look at it under a microscope to know if there are cancerous tissues in the lump or non-cancerous tissues. And then with all these tests, they can determine what kind of treatments can go for you best. Yeah, that is why they're doing all these tests. Now, there are many different types of biopsies. There are particularly 5 main types. I'm going to just state them and try to explain briefly what they are. Now, if you actually get to the stage of a biopsy, they can either do a fine needle aspiration biopsy. This is where they send a fine needle into your breast, being guided by some kind of microscope or a machine to see exactly where the lump is, and they pull some tissue from whatever lump is in your breast, and then they use it to check what is causing that lump and what kind of lump it is. Or they can actually use a core needle. This is a larger needle to get the tissue out and still look at the tissue to know what kind of tissue it is. Now, the third one is a stereotactic imaging. So in the stereotactic imaging, they actually use a stereo image to send something inside, to send a needle inside your breast tissue to remove the tissues in the lump, because it is very, very important for them to get the tissues out of the lump and know what type of lump it is exactly. That is the only way they are going to determine treatment for you. For example, if you go to the hospital and you're having fever, headache, and other things, they will tell you to do blood tests. They might get your urine, get your feces to test and know what actually is wrong with you, right, before the right drug. So this is the same thing. The fact that you're having a lump, they cannot just write drugs for you. They have to do all the tests to know exactly what type of lump before they'll determine the kind of treatment that they can give you. Now, the next type is a vacuum-assisted device to remove to remove tissue. That's why all of them are called different types of biopsy, right? So they actually connect a probe with a vacuum device such that they are removing it is going into the vacuum, and they actually remove it from there, and they test the tissues to know what kind of lump you have and what caused the lump and how it can be treated. The last one is a surgical biopsy. This is one which a small area is cut, and then they send something inside to remove the tissue and then for it to be tested. So all the different types of biopsy is just to remove tissues from the breast lump that is in your breast and for it to be tested. So there you go. If all these things have been done, there are different cases that can come out from all these tests being done. The first case is you have a non-cancerous lump. That is a benign breast lump, which means they will either go for short-term monitoring or they will go on to repeat the breast imaging after a certain period, usually 2 to 3 months, to know what actually is wrong with you, to see if the lump has increased in size, it has changed its shape, it has just had some changes, okay? That is if it is a non-cancerous lump anyways. So now, if they realize that after all the tests, the diagnosis are still questionable, then they'll either refer you to a surgeon to maybe open up and look at what is there actually, or refer you to a specialist who would look more into the problem that you might have. So if the diagnoses are questionable and maybe they are benign, they will refer you to a surgeon to either take it off, or if it's something like a cyst, they'll send a needle inside to pull out the fluids that are in the lump, because for a lump which is a cyst, right, it is just, as I said before, a sac which has water inside. So to treat it, they just have to send a fine small needle, like being guided by a machine. They send the needle inside and they pull out the water. By the time they pull out the water, the cyst will just collapse. It will just die out by itself. The bad thing about cyst is that it can grow again. So they can remove the water from one and then it collapses. And then after some time, another cyst comes up. So they have to keep removing the water, right? There are other lumps which might be left there because they are not dangerous and they might not turn out to be cancer. But at times, for convenience sake, it might be removed. And I would like us to understand that women who have had previous breast conditions are more prone to have breast cancer than women who have never had any breast condition. Okay, so that is it. I was talking about if the diagnosis are questionable. Yeah. So now, if actually after all these tests, the woman is seen to have breast cancer, now they'll work with you. Have to work with your doctor to look at what treatment plan works for you. Okay. They'll look at what treatment plan works for you, depending on the stage and the type of breast cancer that you have. But as I said before, if you have breast cancer, it's not the end of the world. It could be a really traumatizing disease to know that you have, but it is definitely not the end of the world, because the world has become so evolved that there are so many ways that your doctors can help you to treat breast cancer. And there are so many survivors out there. So no matter what you do, try to stay aware, understand, know your breast, like master how your breast is, so that you can know when there is a change. You can know when there is something different about your breast. Sometimes just stand in front of the mirror and look at your breast. It might seem silly, like why are you looking at yourself? But from time to time, stand in front of the mirror, look at your breast. When you're bathing, just try to touch on your breast to feel if there are any differences. Take time to look at your breast. Because these days, sadly enough, someone said some women have mastered the shape of their eyebrows more than the shape of their breasts. And it is very true. Like, we just get up in the morning, we bathe, we pop our brows up, we wear our dress, and we are gone. But we take about 10, 15, 20 minutes to draw our brows. We should concentrate like that on watching our breasts. Because with breast cancer, early detection can really save lives. If you hear of somebody who has died from breast cancer, it means that it was discovered at a stage which it had gone very far, and it could not actually be remedied. So I would like us women, young ladies, to be very conscious about our breasts, okay? Most times we like our breasts looking very perky and nice in front of dresses, but we don't concentrate so much to look at them and examine them, for their health matters. And we have to try as much as we can to concentrate more on looking at our breasts, to just cater for our breasts, because breast cancer is dangerous. It's Breast Cancer Awareness Month, and I'm happy that you were here today to learn something. If you came late, you can obviously go to the beginning of the video after we ended and watch again, because it's very, very important that you at least have an idea of these things. I guess from the videos that we do, you can actually hear something, and while you're watching, you click on your phone and you're like, what is this? And you read a little more about it. It will take you less time, right? So what we do here is we try to give you the tips so that at least it's in your brain. If you go to the hospital and the doctor is saying something about that, at least you've heard it somewhere and you easily recall. If you maybe hear someone talking about something like that, which they don't understand and they can't maybe handle themselves because the doctor told them one very huge terms, at least it'll be something that you've heard. So we just have to stay in the know, okay? So today marks the end of our 10 days Pink Plank Challenge, and I was very, very delighted with the performance of the ladies, with the performance of the ladies on the group. And I would like to give a shout out to some of the ladies on the group who were very, very effective on our 10 days Plan Challenge. First, Lady Chikodili. Lady Chikodili is a Nigerian, and she is always very active in our sports activities. I'd like to say thank you for participating in this. I'm sure a lot of ladies in your crew have learned something from this particular period and have stayed aware. Also, I would like to give a shout out to Lady Maureen, to Lady Jackie Enanga, to Lady Atong Vera, to Lady Eleanor, to Lady Chantal. Who else am I not calling? To Lady Kane, to who else? Let me think of their names. If I don't call somebody here, it's going to be trouble anyways. But I can remember most of them. Lady Lucien, Lady Antonia. Lady Lucien and Lady Antonia are in Equatorial Guinea. Who else joined? Lady Anita, who joined from Qatar. Who else joined? I'm thinking of people out of Cameroon. Lady Dorcas joined as well. I want to just say a very big thank you to everyone who joined, because by joining and sharing your videos with our hashtag, I'm sure you made a lot of people to be aware and to learn something, to be triggered to learn something about breast cancer. Thank you all so much who joined. Lady Cordelia as well who joined. I'm just going through the messages on the group now so that I don't forget somebody. Lady Rudy as well. Yeah, I'm seeing a lot of people join now. Lady Enanga Ella, who joined. I like to call her Ella, who joined. Who else joined? I'm just trying to go through it so I don't leave anybody out. But the ladies were wonderful. Like, I just love how much they joined us to do this. Lady Agita, thank you so much. Lady Jackie, Lady Christy. I'm going through the group so that I can give everyone a shout out. I've already called Lady Eleanor. Who else joined? Lady Henrietta. Lady Henrietta actually had pink hair because we had to wear something pink. But Lady Henrietta had pink hair. Lady Meekness. I'm sure I've called everybody now. Yes, I feel like I've called everybody. Lady Meekness. Who else joined? I think that is everybody who joined. I hope I didn't forget anybody. And myself, I joined too. So thank you all, ladies. Lady Tazisong joined as well. I'm going to look for trouble for myself here because I'm going to be calling names and I'm forgetting some people. But I'm going through so that I don't forget anyone who joined. I've called Lady Cordelia. I've called Lady Vera. Yeah. The first name I called was Lady Chikodili. Lady Maureen, I'm calling them again. If I didn't call you, please don't get mad. I didn't just see your video while I was going through videos, but you did a great job. And if we women can get together like this and support such things, then the awareness will be more and will save more lives. Again, I would like to say thank you for joining. Thank you for being here up till now. What else do I have to say? Stay aware, because knowledge is power, and with breast cancer, early detection saves lives. So if you feel any abnormalities in your breast, please don't wait for 5 days or 1 week. Go to the hospital immediately. Okay, thank you so much for joining. It's going to be good night from me, and hope you have a beautiful night rest. And remember to always take care of yourself, because if a mother is not healthy, there is no way the children you're trying to take care of will be healthy. So make yourself a priority, practice self-care, create some time for yourself, make sure your mental health is intact, because if you so love the people whom are in your life, you should take care of yourself. So have a beautiful day or a beautiful evening, and let's keep raising healthy moms with healthy homes. If you have any questions, please don't hesitate to drop them. We are going to get to them later. Have a beautiful evening, and God bless you. Bye-bye.